Hello everyone, I am Dr. Vamshi Krishna, Consultant Neurosurgeon, Care Hospitals, Hyderabad. Today we will be discussing about the brain tumors, what are its causes, what are the symptoms when they present to us, and what are the treatment options. Per se, brain tumors are the most debilitating conditions and the most taboo in the Indian society, that a case of a brain tumor is considered that lifespan will be considered in less than 6 months. It's a big taboo and big myth. With the recent advances in the neurosurgery, the brain tumor patients are persisting for more than 10 to 15 years with a good recovery. Okay, then we'll discuss about what are the factors, what are the conditions which lead to the brain tumors. Most of the patients, when they present to us with brain tumor, the first thing they'll be worried is why did they occur to me, sir? I don't drink, I don't smoke, or I do not have any bad habits. Why did I have a brain tumor? So per se, brain tumor it does not have any major predisposing factors like a lung cancer or a stomach cancer, where the drinking alcohol or smoking would be one of the risk factor for a brain tumor. In a case of a brain tumor, it would be a genetical reason or a hereditary reason, or it could be an idiopathic where the reason is not known. So to get a brain tumor, the reasons are unknown till now. So when they present to us, what would be the symptoms? Usually brain tumor, the red flag signs for a brain tumor cases would be headache associated with vomiting, and also blurred vision. These three are the red flag signs in a case of a headache who is presenting with these three signs. Then immediately he has to consult a neurosurgeon and get evaluated. Apart from these symptoms, patient may also present with weakness of the either limbs, either the upper limbs, lower limbs, or both upper limbs or both lower limbs, a slurred speech or visual disturbances, and all these factors, all these symptoms may be presented in a case of a brain tumor. So in case of brain tumors, what are the types? So brain tumor could be a benign one, which is a good tumor, which could be resected completely, or it could be a malignant one. A malignant tumor implies that it's an upgraded tumor, or it's an advanced stage tumor. In the benign tumors, it could be, or the tumor types, it could be many types. It could be a metastatic tumor. That is, the tumor might be present in a breast cancer or a spine cancer that has spread to the brain. That is called metastatic tumor. Or the brain tumor is within the brain parenchyma. That could be meningioma or a glioma. Meningioma does not invade the brain parenchyma, whereas glioma, it invades into the brain parenchyma. So based upon this, after you present to a neurosurgeon with these complaints, once he has evaluated you, then we'll get an MRI brain plane and contrast to look for the tumor, where exactly it is located, what are the associated structures it has invaded, then how do you proceed for surgery. All this information can be obtained by MRI brain. So with the recent advancements in the neurosurgery, earlier it was a myth that once you operate a brain tumor patient, eventually they will pass away within 6 months. With the recent advances both in the neurosurgery field and the radiation oncology department, the tumor are being excised completely with a minimally invasive techniques, and also once the tissue diagnosis is obtained, then the patient can go for the radiation therapy. Earlier the radiotherapy was whole brain radiotherapy. Now the radiotherapy is being targeted to a single structure. That is, imagine if I have a CP angle tumor, then the tumor at that complete location we target. So we need not worry about the myths about the brain tumors. Thank you.